Chairman, committee members. My name is Dan Birbek. I'm a captain with the Dallas County Hospital District Police Department, or better known as Parkland Hospital. I'm over our patrol division. I oversee roughly 95 sworn law enforcement officers and about 20 public safety officers that provide security for our system. As you know, Parkland is our level 1 trauma safety net hospital in Dallas County. We see over 1 million patient visits every year. And I want to echo Stan's remarks, what he said up here. I'm neutral in the position. We're neither for or against. We just want to bring some information to educate so that whenever you're making a decision, you'll have this information in front of you. I think it's reasonable to say that as a concealed handgun license carrier myself, for the same reasons that were testified earlier, to buy handguns, and I'm also a staunch Second Support Amendment person, but you have to have common sense when it comes to introducing firearms into certain environments. For instance, we wouldn't allow firearms into our jail facilities, or we wouldn't allow firearms into our psychiatric units. And as a county hospital, Parkland now sees, just in 2014 alone, we had 869 inpatient inmate visits to Parkland Hospital. On our outpatient basis, we have over 3,076 inmate patients. Inside of our emergency room, if you've ever been there, it's elbow to elbow, and prisoners are routinely placed next to patients and so forth and so on. As a result of that, having these prisoners mixed into our patient population, in 1991, we've had several shootings because of this inside of our hospital, where prisoners have attempted to disarm deputies that they were escorted with. In 91, we had a shooting which resulted in one of our police officers being shot by the inmate, and then we in turn shot him 3 times. In 2002, we had an inmate get a weapon and discharge it at the nursing staff in the ED booth. They were taken down by bystanders. And in 2012, we had a capital murder suspect disarm a deputy and was able to make an escape, and it ended up in a 5-hour standoff down on Harry Hines, where we finally took that suspect back into custody. My concern is that the deputies and law enforcement officers are trained to retain their firearms. We practice that, and we have good equipment. Our department carries level 3 holsters for that very reason, so it's hard to get them out of there. And in most cases, when you deal with CHL holders, you have a minimum class that has no retention training, and the equipment that they are carrying is anybody's guess. Anything from a spaghetti strap holder to a good quality holster. But our fear is that these people intermixed with the inmate population that's in our emergency department could result in disaster simply just by not paying attention for half a second, which is what happened to fully trained and prepared deputies. On top of the inmate population that our county hospital sees, we also deal with emergency detentions on a very large number. And emergency detention, what that is a person that is brought to the hospital who is in imminent risk of homicidal or suicidal behavior. And our hospital in 2014 saw 6,860 of these patients. Current FY15, we've already seen 2,870, and these are people that are actively seeking to harm themselves or others. Routinely, they're combative, fighting. We've seen very violent fights inside of our ED from these individuals, and I think if we mix untrained, unprepared citizens into this environment where hospital staff are trained to respond, their response could be something completely tragic inside of an ED that could have been prevented by not allowing the firearm inside of there to begin with. As Stan had mentioned earlier, and also the representative had mentioned, that hospitals do tend to be violent places, and healthcare providers have seen a 300% increase over the last 5 years in assaults on healthcare staff, and this is across the board. It's not just the bad guys, it's good people that are in there that are receiving mind-altering medications, that they become combative and do things that a normal person would not do. So we are trained on how to deal with that, and as Stan mentioned, the de-escalation techniques and restraint methods that are non-lethal and where we try not to injure them, because our first mission is to do no harm and get these people taken care of. At Parkland alone, Parkland staff in 2013, we had 156 employees assaulted by patients. In 2014 to date, we've had, in 2014 we had 230, which is a 47% increase. In current FY15, we have 35 assaults already on record. As already stated, emotions run high in hospitals. People receive devastating news. Their emotions go off the chain, and we've seen really good people otherwise that do things that we would have never expected to see them do, like assaulting staff, punching holes in walls, taking equipment and throwing it. So what is being said is true, and this is coming from boots on the ground. I respond to these calls. My officers respond to these calls, and I see these things happen. We've seen and arrested CHL holders who have threatened hospital staff with firearms, and we've arrested them for that offense. And again, we do have incidences in the community that do end up in our emergency room. Both sides come in, even to the point where we have our own emergency response team, and we are equipped with patrol rifles and everything that we need to handle those things, and we've deployed those to keep the peace and to show a good, strong presence inside of our hospital to make sure that everybody feels safe. We talk a lot about people coming in and visiting, but what hasn't been addressed is the patients that come in to see us. And whenever you come into the hospital to be seen or treated, typically you're asked to derobe and place a hospital gown on so that you can have a procedure. So when you bring a concealed handgun in, or for that matter, open carry, what do you do with that firearm while you're having a procedure done? Is it the hospital's responsibility to train their staff in safely handling firearms? And how are we going to secure those firearms? We're not prepared for that, and we don't have the facilities or equipment to do that. It would be nice if the government is going to enact where you can do open carry or concealed handgun carry in a hospital, to at least give the administrators an option to post the 30.6 sign on their door and give them some discretion over their own campus of whether or not they want to allow firearms in. And if we don't allow that, and we do allow firearms in, one other thing I'd like you guys to take into consideration is that we have psychiatric units inside of our hospital. These are closed psychiatric units. Where do we draw the line? How do we say you cannot take a firearm inside of a psychiatric unit, or you can't take a firearm into our emergency department where we have an emergency psychiatric unit? So the line is kind of fuzzy on how we can enforce that once you say you can come in with your firearm. With that being said, I would have to take any questions.
Thank you very much, Mr. Birbek. Any questions, Representative White?
I do have a question, and I appreciate you sharing, your experience with us. And you talked a lot about, providing safety on the inside of the hospital. How much do you provide on the outside of the hospital? People walking to and from to get to the hospital, those same patients have to go through the parking lot, so they're still interacting with other people. So my question is, what about outside the building when it's late at night or you're alone? Or
I understand your concern. Parkland takes the security of their patients and visitors very seriously. I mean, for a county hospital, we spend over $7 million annually in our police budget, providing cameras, blue phone poles, roving patrols, marked police cars. We have a very heavy presence on our campus.
But is that in every hospital?
I'm sorry?
Is that in every hospital around the state? And
no, I mean, Shamrock
facility?
Is surely different. I just think it's hard to brush a paintbrush across the whole state and think that what's good for Shamrock is good for Parkland Hospital. Mm-hmm. I don't think that's the case, because that would go to allowing an administrator to decide, can you bring it in or can you not? Because Shamrock very well may need that protection and not have the staff or the ability to provide the security for their employees or guests. Whereas Parkland does spend a tremendous amount of money trying to protect and make the facility as safe as we can.
Okay, thank you.
You're welcome.
Thank you, Mr. Birbek.